All right, so we can start in a seated position with, if you have something in front of you to hold on to for the client, that'd be ideal. But if you're in a chair and you have nothing in front of you, this can also work. So I'm gonna have Christina lean forward just a little bit. And we're gonna start with kneading the back of the neck with one hand, grasping broadly. And we're gonna just grasp not too hard between the fingers and the thumb. So moving up and down, kind of from the top of the neck down. Kind of using a pulsing rhythm. And from here, you can move to the other side and do the same thing on this side. So we're using the other hand in this case. Next, we're going to go ahead and move to behind the client, and we're going to grab the shoulders at the top here. And we're just going to take one hand and we're going to kind of grab the top of the shoulder and the trapezius muscle between the thumb and the fingers. And we're just going to squeeze and hold. And you can tell your client to take a deep breath here. Maybe adjust an inch or two towards the spine, where if you may feel any sort of tension, that would be a good place to hold. And we can do the same thing on the other side. You can do this at the same time on both sides. And take your time with these strokes. The last thing we're going to do with the sort of neck area here is we're going to knead the tops of the shoulders like a cat. So you can take your hands, kind of just work that upper trapezius. And if somebody has some really tense shoulders, another way you can access this sort of tension is with your forearm. And so you can kind of just lean your body weight into that elbow or the forearm, checking in with your client to make sure the pressure is okay. Okay, and from here we can work right into the back. This is when it's nice to have something in front of your client so that you can access the spine. So we're going to start pressing up and down along the spine. I like to use the fists, kind of like this. If that's too broad of a pressure, you can get in with your thumbs, kind of work up and down the spine in this way. Careful not to press directly on the middle of the spine. And taking your time. To work the ribs and sort of the sides, you can take a flat palm and sort of using a lighter pressure, kind of pressing in on the ribs, around the shoulder blade. And you'd repeat on the other side. Another sort of nice light stroke is to curl your fingers just a little bit and lightly kind of rake from the side in towards the spine. This is just a nice relaxing stroke. It's not super deep. And you can do that on both sides as well. Okay. Another technique we can use here is we can take our fingers like so, or you can use your palm, and you can kind of traction the muscles from the spine in an outward direction. So palpate your spine, just come a little bit lateral to that and push outward with the palm. And you can work your way all the way down. You can also do this with your fingers. Just kind of lean into them a little bit. At the end of that stroke, you can kind of rock the muscle tissue gently. Press and hold for a few seconds. And along the way with any of these strokes, if you find a spot that's tense, or if the client tells you that it's a tender spot, you can kind of press and hold, sort of at a moderate to firm pressure, anywhere from 15 to 30 seconds, depending on how long it takes for that muscle to release. And you do the same thing on the other side. All right.